A warm welcome to all. Today, I'm going to share with you the topic on sedation and hypnotics. Overview, the definition: sedative depresses CNS activity, while the hypnotics induced sleep-like states at higher dose. Hypnotic drugs that promote sleep onset and maintains primarily used for insomnia. Mechanism: most act on GABA A receptor, enhancing inhibitory neurotransmission. Clinical use: anesthesia, anxiety, alcohol withdrawal, insomnia, procedural sedation. Then, the classification of sedation and hypnotics drug. The sedative and hypnotic drugs include benzodiazepines, barbiturates, non-benzodiazepine hypnotics, melatonin agonist, orexin antagonist, anesthetic agent. The benzodiazepine include diazepam, lorazepam, midazolam, clonazepam. The barbiturates include phenobarbital, thiopentol, pentobarbital. The non-benzodiazepine hypnotics include zolpidem, isopliquone. Melatonin agonists include remilitone, transmelitone. The orexin antagonists include suvorexten, lemborexten. The anesthetic agents include propofol, ketamine, dexmedetomidine. Mechanism: GABA A receptor complex, GABA site, endogenous ligand binding, benzodiazepam site, benzodiazepam and is drug binding, barbiturate site, barbiturate binding, prolonged chloride channels. The chloride channel influx hyperpolarization and it leads to CNS depression. Other mechanisms include regulation, circadian rhythm, and sleep onset, block, wake promotion, hypocretin neuron, act on locus. It produces sedation without respiratory depression. Then dissociative anesthesia and sedation. Benzodiazepam. The drug benzodiazepam onset fast duration 20 to 100 hours. Uses anxiety, withdrawal of alcohol. Lorazepam intermediate duration medium 10 to 20 hours. Seizure and preoperative medication. Midazolam onset very fast. Duration of action short 2 to 6 hours. Procedural sedation. Alprazolam fast. Duration medium 11 to 15 hours. Panic anxiety disorder. Clonazepam onset of action intermediate. Duration 18 to 50 hours. Used for seizure and panic. Pharmacological effects: anxiolytic, anticonvulsant, muscle relaxant, amnesic, sedative, and hypnotics. Clinical uses of indication: insomnia, solpidem drugs, melatonin agonist, benzodiazepine drugs, anxiety and panic, the following drugs: seizure, diazepam, clonazepam, lorazepam, phenobarbital. Procedural sedation, midazolam, propofol, ketamine. Alcohol withdrawal, diazepam or lorazepam. Anesthesia, thiopentol, midazolam. Adverse effect: CNS depressant, tolerance and dependence, drug interaction, respiratory depression, paradoxical reaction, overdose risk, serious depression, sedation, congenital impairment, ataxia, potentiated by alcohol. Physical dependence within weak withdrawal can be life threatening. Drug interaction, synergistic, CNS depressant with opioids, alcohol, antipsychotic, antidepressant. Respiratory depression, risk especially with IV use or combinations critical in COPD and sleep apnea. Have a view on monitoring the sedation and clinical skills. Special population, elderly, pediatrics, pregnancy, hepatic impairment. Have a view on this topic. Then, summary and key takeaway. Sedative and hypnotics primarily act on GABA receptor, enhance chloride influx, and CNS inhibition. Benzodiazepam are most used class, balanced by risk of dependence and abuse. Solpidum are preferred for insomnia due to improved selectivity. Newer agents offer alternative with fewer side effects. Always monitor depth of sedative using validated scale. Special care required in elderly, pediatric, pregnancy, and hepatic or renal impairment. Thank you for your attention.